Thank you. So just to introduce myself, I'm Ankur Banerjee. I work across Accenture UK on digital identity and blockchain practice, generally across industry, so I don't just focus on healthcare. And I wanted to bring along some perspectives, perhaps, from outside the healthcare industry as well. I mentor at something called FinTech Innovation Lab, so I work with a lot of FinTech startups, so try to bring across that flavor. My talk today is going to be about cybersecurity and healthcare and why blockchain particularly can help in that space. But what I want to start with is a personal story of why this made sense to me. So a couple of months ago, I had to go in a few times to an NHS hospital for consultations multiple times. And every single time, I was asked to fill out an intake form that also had sections on how my data would be used. So whether my email or phone number would be used for marketing purposes, how would I be kept up to date, and is it fine to use my medical data for research purposes? But I had to fill that out every single time that I went in there, which didn't particularly fill me with confidence as to whether they were actually capturing that information anywhere and how that data would be processed. And without naming names, this is an NHS trust that has had a bit of a data usage kerfuffle in the past few years, so that also played on my mind. And so part of this problem is the fact that when you fill out all of these intake forms, you get reports, you don't particularly know right now, I think within the healthcare industry, how your data is going to be used. And what that brings up is generally less trust in the organizations themselves. And the reason why we should care about this is because when you look at statistics for data breaches, that's the probabilities of events happening. Like the chance of getting struck by lightning is about one in 960,000. Chance of dating a millionaire is about 220. But the chance of experiencing a data breach is about 1 in 4. So it's not just about how those data choices are being looked at, but what data are they holding about you in the first place.
Oh no, I just
And this has an impact. So we did a research of healthcare data breaches amongst US customers. This is not specific to the UK, but the same statistic holds up. About 1 in 4 had some kind of healthcare data stolen. The knock-on impact of this is not just about their medical information being lost, but that information being used in identity theft in other sectors outside of healthcare as well. It also involves out of costs per incident. This is in terms of credit monitoring services that they have to provide, compensation that they have to provide, cybersecurity incident response that is brought in. So there's a financial cost associated with this, which can be quite high per customer. And what else is the stolen data being used to? It's not just about identity theft. It can be used to purchase items if financial information has been lost, or being fraudulently used to receive care or fill prescriptions. This goes into part of the opioid crisis in the US as well, where sometimes stolen healthcare data is used to fraudulently fill prescriptions to supply within the opioid supply market. And finally, sort of smaller incident, but can be used to access and modify healthcare records as well, perhaps with an eye of getting insurance money. But breaches don't necessarily happen where people necessarily expect it. So in our study, what we found is the highest incidences were actually in hospitals, urgent care clinics, pharmacies, and physicians' offices. Those are the top 4 places where data is being lost. The lowest, in fact, is around tech apps, which we're seeing a lot of them come across within the industry and the government. But it's not just about malicious data breaches that we're talking about. There's incidences of malicious data breaches where somebody actively targets an organization and tries to get their data. But a larger proportion of that, in fact, is inadvertent data breaches. Perhaps leaving file storage locations of healthcare data accessible to a larger subset than people are supposed to, or negligent, where you don't have the right kind of data access controls of who's allowed to access this data. So I want to take a step back from the healthcare industry at this point and talk about a project that I've been working on in the travel industry and tie that back to the similar concepts and what we could use in healthcare to make this better. So imagine you're going traveling. One of the major hassles of travel in general is the amount of documentation that you have to show. You have to show your passports, you have to show what visas you have, what boarding passes you have, and that's fine at the border, where they actually need to see a lot of this information. But imagine that you get along to a hotel, you're in a foreign country, it's quite standard that you have to provide your passport to someone, and they photocopy it, they keep a copy of who you are as a person, and guest registration is a big thing traveling in a lot of places. The problem with that is this happens. So Starwood had a fairly spectacular breach a couple of years ago where they lost passport information, credit card information, and a lot of personal details that were held about users. And besides a major sort of data breach in the organization itself, there's the fact that in the travel industry, a lot of these places are franchisees of big operations, so they're not necessarily owned by the parent company itself. And the person dealing with it is likely close to a minimum wage employee or otherwise, who has just photocopied a lot of information that they could use to steal your identity, if they cared about it enough. So, but imagine a future where you could do this differently. What does the hotel actually need to know at that point? They need to know you have a valid passport, that you have a valid visa for the country, and perhaps your membership number with their hotel reward scheme. And if you could prove the facts that you have the passport, the visa, enough money to spend during the stay, etc., and you could prove it to a high degree of capacity, perhaps they don't need to hold the actual underlying information itself. And that extends out to the rest of the smart devices in the place itself. Like a TV system doesn't need to know what my passport number is or what my phone number is, but right now they would probably be connected up to the same system. So what does this bring us to? How do we get to a point where there's a principle that the Information Commissioner's Office has on data minimization, which is personal data collection should be adequate, relevant, and limited to what is necessary in relation to what you need to do. Right now, the way that we deal with it is to, like the hotel example, keep an actual copy of the document itself. But what if you could limit what data you connect and prove to a high degree of believability about certain facts? And so what this comes to is you can look up a project called ktdi.org, Known Traveler Digital Identity. It's a collaboration that Accenture has been doing with the governments of Canada, Netherlands, the World Economic Forum, Air Canada, and Air France KLM to see how we could create an ecosystem to use decentralized identity for travel and have that concept of data minimization at different places. So what this brings us to is your parts of your identity are not just things like your driving license. They could also be life events like when you graduate from university and the degrees you have and what are you allowed to do. It could be the conference lanyards that you're wearing, that allows you into this conference. That's a different level of believability. I have a pass that says #blockchainbaby because we were expecting one of our colleagues to come along with her baby. Is that actually the name of the baby? No, I hope it was. It's also things like your Oyster card, which might not have your name on it, but is actually quite uniquely personal because it contains all of the travel history of like where you're going around in London. So it's different levels of assurance that combine to form like your identity. And part of the problem has been like we never really had a native standard for how do you handle data digitally. It's always been you fill out like some sort of web form and they either just take it at face value or somebody has to go and check if those details are correct. That applies to financial institutions, that applies to healthcare, that applies to Facebook, like any place. So there was a saying back in the 90s, like, nobody on the internet knows you're a dog. But this brings us to like, there's a better way of like, going about like doing this. And that involves how can we move from highly correlatable information to non-correlatable information? And how much of this can be used to prove certain facts? And where I think blockchain particularly helps is in that transition from the red side of the bar to the green side of the bar on this level. So why is it well suited for data minimization? Part of this is what I call remixing identity from multiple unrelated sources. This is currently hard to do. Imagine you're going and getting a mortgage, like you're probably collecting up 15, 20 different documents from different places, and probably on paper as well. But that's by the by. And that's because going back to what I said about like, the Oyster card, the conference pass, the driving license, like what constitutes your identity is different sources, and how do you then combine them up together? Now, we haven't really had a digital native standard to do that on the web and the internet so far. And that's where a lot of these standardization efforts are going. The second thing is once you've collected up from multiple sources, the second problem usually is verifying if that is been tampered with or if it's been revoked. If I just show you a passport which has been cancelled, you don't know that it's been cancelled unless you hook into another database and check if it's still valid or not. So a lot of the time, even when we're showing paper documents or cards, you have to take at face value that this particular thing is still valid. Now, the way to do this digitally would quite often be you have to integrate with somebody else's APIs, to use a technical term. You would have to make a call to their database and check if this is correct. And that's quite hard to do. If you have to then integrate with 10, 50, 100, maybe 200 different sources, that's hard to do. So what decentralized ID helps with is the fact that you can check if something has been tampered with without necessarily needing to integrate with multiple different sources. I think that's one of the key standout sort of like features. And then it brings to the last part. It's like, how do you verify something is true without hearing, seeing, or speaking the actual underlying data? And that comes to, if I had to prove that I live at a certain address, right now the way that I'd go about it is probably showing something like a utility bill. But what if instead of actually revealing the data, I could show it from 10 different sources that actually say the same thing, and they have assurance that yes, I have lived in the same address for the past 5 years, if that was what someone was trying to find out. And that comes down to, it might be easy to bribe someone or otherwise influence what data is stored digitally at one organization. It's perhaps harder to do that across 6 or 7 or 8 different organizations. So it makes it easier for the receivers of that information to say, actually, you know what, instead of showing one piece of information, show me 5 that say the same thing. And then perhaps it's easier for them to trust something is true without needing the underlying information itself. And beyond people itself, it's about individuals, organizations, things, devices, and places where these elements of identity will start coming up from. Is a contractor trustworthy enough? Like, would you give this give this outsourcing deal to a different organization, can I trust the data that I'm bringing in to my healthcare system from a Fitbit? Is it actually from their Fitbit? Is it actually from their Apple Watch? And healthcare data will get a lot more personal as we have a lot more, I guess, industrialization of the medical technology that comes along and the data sources this comes from. This, in fact, is also happening in the US, also happening in the UK. There are insurers now who will provide you with smartwatches or smart devices to track your information and reduce your premiums based on how active you've been. So how do you trust that information in the first place? So it's not just about the identity of people, but it's also identity of end devices. And this kind of open data ecosystem is already happening in other industries. So to take the fintech example, like I said at the top, I coach and mentor a lot of fintech startups. And while open banking was a bit slow to start and a bit slow to kick off, I think right now in the industry we're seeing some very, very compelling use cases of what this open data ecosystem has allowed. So for instance, there's companies popping up that will help you build a better credit score to get a mortgage based on the fact that you've been paying rent for X amount of years, which is a level of data that has been opaque so far in this kind of decision. Or there are insurance companies that will give you per trip insurance. If I just need to borrow a friend's car for 2 hours and I'm not insured on their car, I can get on-demand insurance that is valid only for that particular trip. Or gadget insurance which only works when I step outside of my house. So there's value that we can see in the fintech industry being unlocked right now, in which we couldn't even predict earlier. Like people essentially started off doing personal finance apps, which is just showing you a graph or a chart of how your finances are doing, and now we're getting to see some very cool implementations on top of that. So to end, there's what I think is there's a waterfall of data that's going to come along as things get more digitized in healthcare, as a lot of them become end devices that are there with the patients and the users themselves. And what blockchain can particularly help with is building that open data ecosystem. But unlike fintech, there's a greater care, the greater duty of care within this space. And so what it can help is minimize the amount of data that needs to be captured in the first place, and is trustworthy in the sense that it's not been tampered with. That's me. Any questions? Yes? Hi.
I think the mic's just coming around.
Okay, no worries. Hi, I'm David Gadd. Brilliant presentation. Thank you very much indeed. So my question is, en masse, when are the general public going to wake up to the fact that they're at exposure and can be easily hacked with informed data? In this room here, be interested to see how many people have actually had their data hacked on a personal level. So people know of other people who have, but on masses, when is it going to change? Because you're absolutely right, everything you've said there is just fantastic. Just moving back from Canada, they're still doing an awful lot around the driving licence and data on the driving licence. So my question is, on masses, how can we educate people that this is so vital?
I think masses don't necessarily care if it's on a blockchain or if it's more secure. I don't. That's a core part of the message. I think that often gets driven by media coverage on honing in on certain issues. Like the Facebook thing blew up, even though it was very openly reported in the press as to what data collection practices they were doing. So, but there was a flashpoint where something triggered them. So I think when there's an emotional connection to the impact of how the data was used or perhaps breached, that's when people wake up. But I think the way to sell it to masses is not just to focus on the security and the privacy angle. That's something healthcare providers or people working in the healthcare tech industry need to care about. What the masters will care about is making usage of services simpler and more seamless for them. And I think that particular angle lands a lot more with them. There's a way to make engaging, seamless, and useful services without caring about the data minimization principles. So I think from the en masse perspective, it's our duty to look at how simple can we make it. From a healthcare tech provider industry, it's how secure can we make it.
Hi, thanks for the talk. Can you share a bit more details about the prototype you described? What were the technical tools you've been using? What was the outcome? What was the barriers? How far do you see it from being deployed?
Is this the known traveler digital identity?
Yeah, yeah.
Okay. So it's an evolution of multiple projects we've been doing in that space. It actually started back in 2017 with something called ID 2020. Which was a public-private partnership on providing digital ID for people like refugees and people who don't have ID. That was a bit of a prototype, and it was to spark discussions at that particular conference. But what it's moved on from there is we've applied it to looking at trustworthiness of contract drivers for our employees in India. Like, have they been known for assaulting drivers, or have they been known for selling off their particular slot to someone else? Known traveler digital identity is the next stage of that. We've done pilots right now with a couple of hundred people going through Amsterdam Schiphol Airport and Toronto and Montreal airports. We've also worked with the airlines directly and with the governments directly. So the conversation right now is still in progress, and it's more around how the governments then deal with what kind of information they want to issue in a decentralized fashion, and what kind of usage is how long is it maintained, how long is it issued for, and how long will it be revoked for. So those conversations are still ongoing, and what we're also trying to do with the World Economic Forum is to expand it outside of those two governments and those two airlines.
Do you feel like they have faith in the technology, or are they?
Yeah, I think Canada and Netherlands especially are taking a very a future forward look at this kind of technology, and Canada especially has been looking at decentralized identity not just in travel but in multiple places. I think the larger, broader challenge has been to go beyond those countries, because otherwise, if it only applies to travel between those two locations, then it's not as compelling for end users.
Great, thanks.
Okay. Helen's telling me time out.